Good morning. Today, after you people have studied Haemophilus, we are moving on to an important gram-negative bacillus belonging to the genus Brucella. You will be studying it under the following headings of Introduction and History, the Morphology of Brucellae, Growth Characteristics, which includes both the cultural characteristics as well as the biochemical characteristics, the classification and antigenic structure of Brucellae, the pathogenesis of human brucellosis, the clinical manifestations, how does it present, how do we diagnose, and how can we treat and prevent brucellosis. Now coming to Introduction and History of Brucellosis. The human brucellosis was known as far back as 450 BC. It was already described by Hippocrates. Those days it was called as Malta fever or undulant fever or Mediterranean fever. Malta fever because it was seen in the Malta area of Mediterranean region. Hence Malta fever. Mediterranean fever because around the Mediterranean region it was seen, and undulant fever due to its characteristic fever which undulates, means it rises and falls. Hence it was also called as undulant fever. In the later part of 19th century, Sir David Bruce, who was a British Army physician as well as a microbiologist, he isolated Brucellae in pure culture and linked its causation to Malta fever. He named it Micrococcus melitensis. Melita is the Italian name for Mediterranean. He called it Micrococcus melitensis. Later on, when the genus was named after Sir David Bruce as Brucella, the organism was renamed as Brucella melitensis. Simultaneously, again around the later part of 19th century, Sir Bernard Bang discovered Brucella abortus, which was causing repeated abortions in cattle. In early part of 20th century, after the genus was named after Sir David Bruce, Ellis Evans advocated that pasteurization of cattle and goat's milk could prevent brucellosis. Later on, many other species of Brucella have been discovered, and to date we have around 7 species. Apart from Brucella melitensis and Brucella abortus, we have Brucella suis, Brucella canis, Brucella ovis, Brucella neotome. Coming to the morphology of Brucellae. The Brucellae are small gram-negative cocobacilli. They are slightly bigger than cocci and smaller than a normal bacillary body. So, they are cocobacilli, small, round to oval. They are gram-negative, non-sporing and non-capsulated. They are non-motile, non-acid fast, but may resist decolorization by weak acid or alkali, and hence modified Zn can be used as screening method for placentas and products of abortion in cattle. Coming to cultural characteristics of Brucellae, please remember Brucellae are strict aerobes. Strict aerobes means they cannot withstand absence of oxygen, and they are highly fastidious, means they do not grow very well on the routine basal media. They require extra nutrition to be supplemented in the basal media for them to grow. The optimum pH being around neutral pH 6.6 to 7.4. Optimum temperature being the human body temperature of 37 degrees, but they can survive or they are viable over a large range of temperature 20 to 40 degrees. They may grow on ordinary culture media, but the growth is extremely slow, and since they are fastidious, they require to be supplemented with either glucose, serum, blood or liver extract or potato into the basal media. On the solid media, they grow like any other gram-negative bacillus colony, which are grey, small, moist and translucent. In liquid media, the growth is more or less uniform. Coming to the biochemical characteristics, Brucellae, since they are strict aerobes, they cannot ferment carbohydrates. Why is that? Because the enzymes which are required for fermentation of carbohydrates, which are called as carboxylases, these carboxylases are activated only in an anaerobic environment. And since Brucellae are strict aerobes, they cannot provide an anaerobic environment, hence they do not produce carboxylases. They do not produce carboxylases, so they cannot ferment the sugars. But that doesn't mean they cannot utilize sugars. They utilize sugars by oxidation. They are catalase positive, means they produce the enzyme catalase. They are oxidase positive except for few strains of Brucella neotome and Brucella ovis. They are urease positive, means they produce the enzyme urease. They are nitrates positive, means they reduce nitrates to nitrites. And the other important reactions, that is indole, MR, VP, citrate, are all negative. So for you people to remember, they are strict aerobes and they are oxidation or they are catalase positive, oxidase positive, urease positive, nitrates positive. All other reactions are negative for all the Brucellae. Coming to classification of Brucellae. 3 important Brucella species are known. By now you are familiarized with the words Brucella melitensis, abortus, suis, canis. So the classification is basically based on the animal host which act as their reservoirs and their cultural characters and the amount of antigens. So based on that we have Brucella melitensis, which are the pathogens of goats and sheep. Brucella abortus, whose reservoir are the cattle. Brucella suis, swine means pigs. So the reservoirs for Brucella suis are pigs. Brucella canis means canines. The reservoirs are dogs, jackals, foxes and all. Brucella ovis, whose reservoirs are rams. Brucella neotome, which were seen in desert wood rats. And recently Brucella microti has been discovered, which is found in voles. The antigenic structure of Brucellae is like any other gram-negative bacillus. They have somatic antigens. Brucellae are known to have 2 important somatic antigens called as A and M. These were named as A and M based on their proportions present in the most important human pathogens, that is abortus and melitensis. Means the antigen was named as A antigen because the proportion of this A antigen is more in Brucella abortus. Similarly, the proportion of M antigen is more in Brucella melitensis. Brucella suis exhibits an almost equal proportions of both A and M antigens. Further typing, which is called as intra-species typing of Brucella, has led to various biotypes. Brucella abortus shows 7 biotypes, Brucella melitensis has 3 biotypes, Brucella suis has 5 biotypes, Brucella canis, Brucella ovis and Brucella neotome till now have shown only 1 biotype. Coming to the pathogenesis of human brucellosis. The disease is called as brucellosis. These brucellae are enzootic organisms. Enzootic means endemic in animals. Means the disease caused by brucellae is endemic, means very common in animals. So the human brucellosis that way becomes a zoonotic disease. The 3 major species which can cause human infections are Brucella melitensis being most virulent, followed by Brucella suis and Brucella abortus being least pathogenic to humans. Brucellosis is primarily a disease of reticuloendothelial system, and we get infected when we come in direct or indirect contact with the infected animals, since it is a zoonotic disease. Now, whenever we are speaking about pathogenesis of any disease, The various modes of infection and routes of transmission of the organism are very important. The various modes of infection or the ways in which humans can get infected by brucellosis are by drinking contaminated raw milk or ingestion of milk and milk products from these infected animals, direct contact with infected animal tissue like blood, placenta, urine or feces. Then there can be an accidental ingestion, inhalation, injection or mucosal or skin contamination in laboratory workers who are working on brucella. Now that you know various ways in which humans can get infected, what are the different routes of these modes? So brucella can enter humans either through skin abrasions, through gut, that is by ingestion, or nasal, the respiratory tract, through inhalation, or mucosal surfaces like conjunctiva. Now look at this picture. Here it shows the important reservoirs of brucellosis, that is the cattle, the goats or sheep, the dogs and the swine. The disease exists in these animals since it is an enzootic disease. So all these animals will be infected and from them we get infection. Plus the professional or vocational exposure in laboratory workers who work on brucellosis also can get infected due to the cultures of brucellosis. Now once brucellosis entered, so now you know the various ways in which it can enter and the routes through which it enters human body. Once brucellosis have entered, in the site of infection, at the site of entry, they multiply and through lymphatics they go to the local lymph nodes, multiply in the lymph nodes and they spill over into the blood circulation. Once in the general circulation, they can disseminate throughout the body and they go and settle in the various reticuloendothelial organs. Brucellosis are known to have a special predilection for placenta because placenta has a substance called as erythritol. This erythritol is a component which encourages or supports the growth of brucellosis. That's why the organisms, when multiply in large numbers in placenta, can lead to abortion, recurrent abortion in these animals. And that is why, and that is how actually brucellosis was discovered to be a zoonotic disease. Immunity in brucellosis in humans is through cell-mediated immunity. Since brucellosis are intracellular organisms, means which survive intracellularly, continue to infect being intracellular, for such organisms it's always the cell-mediated immunity which protects the humans. So as a part of activation of CMI, the Th1 or the T helper cells get activated. They release large amount of interferon gamma, which in turn activates macrophages, which can cause intracellular killing of the brucellosis. Due to all this, that means activation of T helper cells leading to release of interferon gamma, which in turn activates macrophages, which can cause killing of the brucellosis. This leads to formation of granuloma in all these reticuloendothelial organs. The granulomas contain epithelial cells, giant cells, lymphocytes and plasma cells. Simultaneously, the Th2 cells are also activated, which release interleukin 4, 6 and 10, and they lead to formation of antibodies. The antibodies formed in brucellosis are very non-specific and they do not play a major role in protection. A very minor role is being played by the antibodies in brucellosis. Why this becomes important? Because since the antibodies are very non-specific, their detection may not help in diagnosis. That is why we have to know whether the organism is an intracellular organism or a extracellular, or means it survives extracellularly, because for intracellular organisms it is CMI which gives immunity, and for extracellular organisms it is humoral or antibody mediated immunity which protects. Now Look at this picture. It shows various reticuloendothelial organs which are affected in brucellosis. All the macrophages, the liver, the spleen, the lymph nodes and the bone marrow are harboring the brucellae. Now coming to the presentation in human brucellosis. The incubation period varies from 2 to 3 weeks and may extend up to 6 months. Human brucellosis is a febrile illness with protean clinical manifestations. Protean means varied clinical manifestations. It is not exact. This symptoms means brucellosis. It's not like that. Varied clinical manifestations means similar symptoms can be produced by other diseases as well. So very vague clinical manifestations are produced by brucellosis. These manifestations can be acute brucellosis or chronic brucellosis. Acute brucellosis is exhibited by prolonged bacteremia. It happens due to bacteremia, wherein the patient will have irregular fever. The fever is typically undulant, means there are waves of fever. Fever rises and falls and it is intermittent. This is called as undulant fever. The patient may also complain of muscular pains, joint pains. The articular pains are mainly of the larger joints like knee, hip, ankle, and low back pain is also a very common complaint by these patients. Patients may experience anorexia, constipation, exhaustion. Nocturnal drenching sweats and chills is also a very important feature of acute brucellosis. You may see hepatosplenomegaly and other non-specific symptoms like headache, diarrhea, rash, weight loss, vomiting may be exhibited in a small proportion of patients. So acute brucellosis is generally a triad of fever, joint pains and nocturnal sweating. These patients are known to complain of sweating over the forehead. So these three important symptoms, that is the triad of fever, joint pain and nocturnal sweating, along with hepatosplenomegaly, you should suspect acute brucellosis in people who have either professional history or they have a history of handling animals. Then this disease or acute brucellosis goes into a phase of chronicity because the brucellae are settled in the reticuloendothelial organs and they remain, since they are intracellular, they remain multiplying in these reticuloendothelial organs and brucellosis becomes chronic. In chronic brucellosis, there is no bacteremia. Very low grade infection with in between exacerbations may be seen. Central nervous system and CVS symptoms may be seen in chronic brucellosis like lethargy, depression, very rarely meningitis could be the only presentation also. Endocarditis, though very rare, can be only presentation in chronic brucellosis. Patients with chronic brucellosis exhibit a hypersensitivity, type 4 hypersensitivity reaction to brucellar antigen. Now coming to laboratory diagnosis. So by now you know which are all the organs infected by brucellae and you know the symptoms of the patients coming with brucellosis. So you should also be able to tell at this time what are all these specimens that we will collect for lab diagnosis of brucellosis. Mainly blood, because brucellae remain in blood during acute brucellosis. Bone marrow, CSF and other tissues like placenta can be the specimen for diagnosis. Once we get all these samples, apart from blood, we do for rest of the samples, we do a microscopy. The microscopic picture will be that of a small gram-negative coco bacilli. So when we put it up for culture, you all know brucellae are highly fastidious. So we need to provide blood and serum and a small amount of carbon dioxide to increase their growth, and it takes several weeks, around 2 to 4 weeks for their growth. Blood is the most common sample used for diagnosis, so blood culture is the best way. And the medium is used is invariably the brain heart infusion broth and agar medium, which is the biphasic medium. Since they take a very long time to grow, repeated subculture from the broth is required, and a biphasic medium or a Castaneda's medium, which contains both the agar and the broth, is preferred medium because that will prevent repeated subculture. When we are supposed to do a repeated subculture, we have to open the blood culture broth repeatedly and subculture from the broth onto a solid agar plate. By using this biphasic medium, we prevent that repeated opening of the blood culture bottle. So, in that way we are preventing exposure of the laboratory personnel who work on brucellosis, because when we use biphasic medium, we just have to tilt the broth over to the solid agar medium in the same bottle. Once the broth flows over the agar, if there are brucellosis, they will settle down on it and lead to formation of colonies. So, that way we are preventing repeated opening of the blood culture bottle. So, a Castaneda's or biphasic medium is preferred over conventional medium. It takes around 2 to 4 weeks of incubation for brucellosis to grow like this conventionally. Some of the automated systems like BacTech or BacT Alert have given growth earliest within 7 to 10 days, but these are automated systems. Next, if not culture, then serology can be used to diagnose brucellosis. Since it is a chronic disease, once the acute brucellosis goes into a phase of chronicity, the bacteria may not be seen in blood, hence culture may not yield much, but antibodies would have been produced. So, serology can be used to diagnose brucellosis at this time. So, what serological methods are available? The serum is collected and agglutination tests are performed, or nowadays we have very good ELISA systems to detect the antibodies. The agglutination tests for brucellosis can be slide agglutination or tube agglutination. A very well known slide agglutination test is Rose Bengal plate test, which is a slide agglutination test wherein the serum of the patient is mixed with the dyed or colored brucella antigen. If the antibodies are present in the serum, it will lead to agglutination of the colored antigen. We can see the agglutinates or the clumps with the naked eye, that is slide agglutination test. A very important, popular and a good tube agglutination test called as standard agglutination test or SAT is available for brucellosis. This is similar to our Vidal test done in typhoid fever, wherein a serial dilution of the patient's serum is made, to which a constant or a known proportion of antigen, brucellar antigen is added. Significant titers of 1 in 160 and above are considered infective or significant titers. Always tube agglutination test has to be performed on paired serum sample, means it is performed once and a convalescent serum is collected again after say 7 to 10 days, and again a SAT has to be performed for the confirmatory rise in titers. This SAT or standard agglutination test is known to give lot of false negatives and false positives. The false negative testing is mainly because of the prozone phenomenon, presence of large amount of antibodies. So, false negative is possible, and false positivity is due to cross reaction of brucellar antigens with many other human pathogens like Salmonella, Listeria and others. To reduce this prozone phenomenon, or to make the SAT more specific, 2-mercaptoethanol can be added, which detects specially IgG, the specific IgG of brucella. So 2-ME addition of 2-mercaptoethanol to SAT makes it more specific test. Then now we also have molecular testing kits available which use PCR, wherein RRS, RRL genes or the outer membrane protein 2 gene or the insertion sequence 711 primers are available, and the method used is PCR to detect these particular genes, which will confirm the diagnosis. So in a nutshell, how do we diagnose? First of all, the history is extremely important for the clinical diagnosis of brucellosis, wherein you have to concentrate on the occupation that the patient is doing, whether there is a contact or consumption of raw milk, uncooked or improperly cooked meat, unpasteurized milk, fresh cheese, whether there are travel history, then look for signs and symptoms. With all this history, if the signs and symptoms of brucellosis are present, then at the back of your mind, please think of brucellosis, since it presents in a very protean way, that is varied clinical manifestations. So not many clinicians think about brucellosis. So give a lot of importance to occupation here and consumption. So once you have made a diagnosis of clinical brucellosis, then laboratory diagnosis could be made based on whether the patient is in acute brucellosis or chronic. If acute, blood would be the best sample for culturing. And if it is chronic, preferably antibody detection would help you in diagnosis. Culture and antibody detection using the SAT test will confirm your diagnosis. Okay. Other tests which can be used to detect or diagnose brucellosis are hypersensitivity test when it is a case of chronic brucellosis. This is a type 4 hypersensitivity test called as brucellin skin test. Then animal inoculation using guinea pig can be performed, wherein the sample or the blood from the patient is injected into the thigh of the guinea pig, and lymph node or splenic aspirate after the death of the animal is used to culture brucellae. Then this was about diagnosis in humans. In animals, diagnosis can be made by isolation of brucellae from the milk or milk products. A popular test called as milk ring test is being performed in the dairies and all, wherein a pooled milk means milk which has been obtained from various sources, from different places, is all pooled at one place, and a small amount of this pooled milk is taken in a test tube and a drop of stained brucella antigen is added. A colored ring appears on top of the milk if the milk contains antibodies. The rest of the milk will remain, the column of the milk will remain unstained. Only a single ring, a colored ring is produced on the top. This is called as milk ring test, which is performed in dairies. Now you know how brucellosis presents, how do you suspect clinical brucellosis, how do you confirm it in laboratory. Now how do you treat, if at all you come in, if at all you have to treat a case of brucellosis. WHO regimen is treating with rifampicin and doxycycline for a period of 6 weeks. The treatment has to be for a period of 6 weeks. Streptomycin can be added for a period of 6 weeks again. Ceftriaxone if CNS manifestations are there. So this is about the treatment. So the ideal treatment is doxycycline for 6 weeks. Doxycycline plus streptomycin is a preferred treatment because rifampicin we want to keep it for TB. Otherwise, a rampant use of rifampicin may lead to rifampicin resistance, which is already a nuisance in TB. So, the preferred treatment would be doxycycline plus streptomycin for a period of 6 weeks, and add ceftriaxone if CNS manifestations are there. Most importantly, how can we prevent acquisition of brucellae? General prophylactic measures like pasteurization of milk, Proper cooking, that means do not consume improperly cooked meat or milk products. And prevent direct contact with tissues. This is applicable to the veterinary staff or the veterinarians who conduct the labor or the delivery of the cattle or animals. They do not wear a long rubber glove. They wear the surgical gloves which are up to the wrist level. This is not advisable for veterinarians. When they are conducting a delivery, they are supposed to wear the long rubber gloves which will cover up to their elbow. Okay, so they should prevent coming in contact with the tissues of these animals, especially when when the cattle owner gives a history that the cow is having a repeated abortion. Then all the more the veterinarian should suspect brucellosis in the animal, and he should prevent acquiring brucellosis by wearing long gloves. All right. Okay. Now, immunoprophylaxis for humans, there is a vaccine, a live attenuated vaccine of the Brucella abortus 19BA strain. This is not used for general public, but used for all the people who are prone or who are professionally exposed to brucellosis, that is the laboratory workers who work on brucellae, or the veterinary staff, or the cattle owners, people who are working in dairy industry, people who are working in meat industry. For them, this prophylaxis is given, which is a live attenuated vaccine of Brucella abortus 19BA strain. For the animals, we have Brucella abortus 19BA for cattle and Brucella melitensis Rev 1 for sheep. The cattle or sheep have to be vaccinated every year so that they don't get infected with brucellosis. So, we have come to the end of the class. To summarize today's class, brucellosis are enzootic disease in cattle, sheep, swine, dogs and other animals. Hence, brucellosis is a zoonotic disease. Brucellae are small gram-negative cocobacilli. They are highly fastidious and they are strict aerobes. Patients with human brucellosis present with varied clinical features, more so called as pyrexia of unknown origin. So, whenever you come across a patient with pyrexia, and you are not able to localize the origin of this, we call it PUO. Please think of brucellosis also could be a cause of your PUO patient. History is extremely important. Pay more attention to the profession, the undulant nature of the fever and vague symptoms that the patient may present with. Diagnosis can be made with culture by adding extra nutrition, that is they need, since they are fastidious, they require special media and they grow very slowly, so the incubation should be for a very long period, and since the disease can be chronic, serology or the molecular techniques can also be used to diagnose brucellosis. Most widely used tests are the standard agglutination test, which is a tube agglutination test, and ELISA for detection of IgG and IgM antibodies. Treatment is for 6 weeks. 6 weeks treatment or compliance is a must, and preferably doxycycline with streptomycin over a period of 6 weeks should be fine to treat brucellosis. And prevention is possible. Human prophylaxis, we have a vaccine. The people who are at risk should be vaccinated. Animals also have to be vaccinated regularly. So that is all about brucellosis. Thank you.